Welcome back to another MedTalk. I'm Shane.
And I'm Ruby.
And today on MedTalk, we will be discussing migraines. Migraines are a type of headache that causes pulsating and pounding sensations to usually one side of the head. The internal cause of migraines are waves of nerve cell activity that floods the trigeminal nerve, which then releases neurotransmitters that change the size of blood vessels, causing an inflammatory process and pain. This leads to the excitement of abnormal brain activity that overall affects your nerve systems, as well as the chemicals and blood cells in the brain. You must also keep in mind that migraines often run in families.
Triggers for migraines involve anxiety, tension, shock, depression, or poor quality sleep. Think about migraines like this. When you suddenly feel like your head hurts, most of the time worse than normal headaches, and coincidentally your senses become conflicted. You are confused and lose the sense of method of operating. Symptoms of a migraine include nausea, vomiting, dizziness, and extreme sensitivity to sound and light.
Two major categories of migraines are migraines with aura, which are classical migraines, and migraines without aura, which are common migraines. Migraine with aura meaning visual, is a type of migraine where you have extreme visual symptoms, like lines, shapes, or flashes that appear. In worst cases, those who experience migraines with aura lose their vision for 10 to 30 minutes and experience tingling sensations in the body. These painful symptoms last at the maximum of 1 hour. On the other hand, migraines without aura means that it affects your other senses, like your ability to move. When experiencing a migraine without aura, you tend to demonstrate speech impairments, muscle weakness, and confusion.
The normality of migraines is that they appear during childhood, but get increasingly worse throughout adolescence. The good news is that they become scarce after age 50. In the meantime, it is crucial that we learn how to deal with migraines, since they most evidently appear in teens. When a migraine begins, it's helpful to seclude yourself in a dark and quiet room. If possible, to also put cold compresses pressure on the painful areas, and to take medication for nausea and vomiting. To reduce the possibility of a migraine, be aware of mental, emotional, physical, or environmental triggers, but surprisingly few triggers as well.
Thanks for watching. We'll see you next time on MedTalk.